Welcome to the Equine Energy Medicine Podcast with your host, Audrey McLaughlin.
Hey friends, welcome to episode 37 of the Equine Energy Medicine Podcast. I'm your host, equine naturopath and nutritionist, Audrey. So today we're talking about red light therapy for horses, and I've got some new information coming out. I've been deep in the research, and I mean deep in the research on chronic pain and chronic pain issues for horses. So I'm going to give the red light recommendations because I do think red light can be helpful, but ultimately, I want you to think of red light as something to support horses' healing and not something to heal horses. And anytime we're having to do this on the regular, then we need to assess what else is going on. Now, most conditions that keep horses stuck in a stall, whether it is acute, meaning like sudden, or chronic, meaning long-term, can be treated and potentially even prevented with a treatment like red and near infrared light therapy or cold laser as well. So that got your attention, right? So I will link in the show notes for two things you want to go through to find this helpful. Number one, my upcoming red light therapy class at the end of September. And number two, my very favorite affordable red light horse tool really for horse owners. But first I want to talk about the science and what all it's good for. So where can you get red light therapy? Well, a few places. You may have a practitioner that can do that for you. It may be a body worker. It might be a chiropractor, maybe even a vet or a naturopath like myself. The problem is when practitioners come out to treat or use it as a part of a treatment, it is absolutely beneficial. But the real magic happens with red light with repeated treatment, probably way more frequently than you're willing to pay any of us to come out and do it. Or that you can maybe even get on the schedule for someone to come out and do it. So that leaves you with what option, right? Well, if it's me, if I'm your practitioner and red light is appropriate for your horse, then I'm telling you to buy the red light in the show notes. And no, I'm not affiliated, but it is an Amazon link, like an associate link or whatever. And showing you what to do is part of what I will do with an in-person client, so that you can do it daily or every other day or multiple times a day, depending on the issue and what's appropriate. So when I say red light, what is it that I'm talking about? Red light therapy is known as LLLT, low level light therapy, LLLT, or photobiomodulation. It encompasses all visible red light, which we're going to get into the science here, kind of ranges from the 630 to 660 nanometers range. And then you have near infrared light, which is just outside of that visible range, particularly for humans. And that ranges from 810 nanometers to 850 nanometers. Now, light waves within both of these ranges are said to be within the therapeutic window, meaning there are significant benefits without adverse reactions or side effects in the 630 to 660 range and the 810 to 850 range. Now, the way we administer this treatment is through LED bulbs. They're placed at the shortest possible distance from one another on a panel. If you're using a panel to ensure most even coverage, they can also be placed in a wand. And sometimes it's a wand that looks kind of like a shower head. And sometimes it's a much more precise wand that might have one or even three light LEDs, or you call them diodes or bulbs, inside of it. The one that I'm recommending for you to buy has three little light bulbs in it, all at different wavelengths within the therapeutic window. And one of them is outside the range of visible light for humans. So when you look at your red light device, and don't put it in your eye, but when you look at it, it'll look like one light is burnt out. That one is actually lit, but it's in that 810 to 850 range. Now, anytime you see the word LED therapy, be sure you understand what wavelengths it's referring to. Some LED panels, for instance, emit blue light or an amber light, as well as red or near infrared. Blue light is very effective at treating some things, right? It's helpful with skin infections. It's helpful with any kind of boil or disruption. But only specific wavelengths, red and NIR or near infrared, really show therapeutic benefits for deep tissue wound healing. Okay. Now, since horses are very large, obviously, and they have a relatively thick hide and often along with a really thick coat, the use of near infrared wavelength is most effective in treating muscle, soft tissue, and joint conditions. That's because, so that's that 810 to 850. That's because these longer wavelengths have a much deeper absorption rate, a much deeper penetration rate than the shorter wavelength visible red light. Not to say the visible red light is ineffective. It's just if we're looking at muscle, soft tissue, joint conditions, ligaments and tendons, we want to make sure that there is near infrared light included in that. Okay. Now, red light wavelengths and NIR wavelengths penetrate the body's tissue to different depths. So if we're looking more towards skin deep healing, like wounds, red wavelengths absolutely stimulate healing. For deeper conditions, muscle tears, joint pain, you want to go with NIR wavelengths or a combination of both. After it gets through the skin, red and NIR wavelengths, or near infrared, I'm not sure what's easier for y'all to understand if I say NIR or near infrared, but those wavelengths stimulate the production of cellular energy. And they do that inside these tiny organelles known as mitochondria. You've probably heard of mitochondria before. It is the energy, the powerhouse inside the cell. If you think back to I don't know, sixth grade math, you probably have a good idea of what we're talking about there. But when you get the red wavelength or the near infrared wavelength inside that mitochondria, it sparks a variety of biological processes that are really beneficial and energize the cell. And that helps them to perform their really specialized functions faster and more efficiently. These are the healer cells, but it's also the job of mitochondria to convert raw materials into fuel for cells. But inflammation and all sorts of different things, poor diet, all these things interfere with mitochondrial functioning. Hopefully I haven't lost y'all yet. We're still deep in the science. And so what happens is we end up with mitochondrial dysfunction. And that has been shown to be the root cause of many chronic conditions that interfere with healing and prevent your horse from enjoying optimal health. Now, if you've been hanging around with me for a while, you know that there is multiple roots to a cause, right? And I like to use the analogy of a tree. So what you see above the ground, the health or not health, the health or unhealthiness of a tree, the health or unhealthiness of the fruit it bears or its inability to bear fruit or any of those things is dependent on what's going on under the surface. It's dependent on the roots, correct? So if you were to dig up the roots or find a tree where you can kind of see the roots above the ground a little bit, there's not one root. There are multiple roots that lead to the outward expression of the tree. It's the same thing for your horses. So mitochondrial health, while one of the primary roots, is not going to be the only root to what is going on with your horse. So the reason why I'm diving all the way into all of this mitochondrial stuff and all the wavelengths is because it's important for you to know, if you're going to use a tool, that the primary effect, the primary impact of red and near infrared light is to reverse and prevent mitochondrial dysfunction. And then when that starts to happen, there's a ripple effect of energized cells that includes faster healing, a stronger immune system, reducing inflammation, building collagen. All of these things cascade or follow this initial trigger of mitochondrial health. Red light therapy increases the body's ability to produce collagen, to get rid of bad collagen or to get rid of poor health, collagen and poor health. And typically we think of collagen in conjunction with skin health. But collagen's actually the most abundant protein in the human body, but as well as in the horse's body. Collagen is found in bones, tendons, muscles, and ligaments. And so boosting collagen production in horses helps them to heal from injury by allowing their body to rebuild those damaged connective tissues. And if the horse has a skin wound, it will heal more cleanly and with less scarring. It's the same internally if you have the proper wavelengths. So just to review, we have two different types of wavelengths, two different types of red light that help horses heal. Red light, period, which is the lower wavelength, the shorter wavelength, it penetrates the skin about 1/2 inch to 1 inch. Okay. So the red light goes about, you could say epidermis and dermis deep, but it actually goes a little bit below the dermis. Whereas near infrared light can penetrate much deeper than that, all the way to joints and bones. And then depending on where it's placed on the body, could penetrate even deeper into organ tissue as well. That's why you got to have a little bit of education on how and where to use it. But what happens is that we reduce inflammation, we improve circulation, and most importantly, we heal mitochondrial function. So what specifically can these things help with? Well, it helps with joint pain. That could be joint pain from arthritis. It could be joint pain from an overuse injury. It could be joint pain that is supposedly caused by a cartilage degeneration of some sort. It can help with wounds. So this could be superficial wounds. This could be big, bad, ugly, gnarly wounds. It will absolutely help with wound healing, period, whether you have a wand or the pads, okay? Joint pain, cartilage healing, you're going to need to have the near infrared light. Wounds, you can have the pads, although I find they get messy. I like to use the wands. So either the shower head looking wands or the handheld, they kind of look like a pen light almost. Connective tissue injuries, so sprains and strains of ligaments and tendons, muscle injuries, strains, tears, cartilage degradation. So again, that's overuse. Sometimes it's caused by bone spurs and things. But bone spurs, we have a whole healing protocol to help dissolve and help the body resorb those. Muscle recovery from training. It can be helpful, particularly the pads, the red light therapy can be helpful there. It does need to have some near infrared bulbs in there to penetrate much past the skin. Back pain, inflammation, neuropathy, or nerve pain. All of these things are really beneficial for red light. There's also some information about using a red light to kick the horse into that rest and digest. Kick is probably a bad analogy to use for a horse, but to help the horse switch from fight or flight into that rest and digest, that restful, calm state. So there's some points you can use for that as well. Now, the last point I'll make is that, we talked about how far red light and near infrared can penetrate. You want to consider that when you're considering what type of light you're using, what problem you're using it for, what distance you're using it from the body. So I see a lot of people that have like the red light panels hung in a stall, or a red light panel set up next to a horse, or 5 feet from the horse, or 2 feet from the horse, or a foot from the horse. So you have to understand the equipment that you have and how close it needs to be, or how far away it needs to be. And then lastly, we're always looking for response, right? So what kind of response are we getting, and how does that encourage us to switch up our treatment plans or protocols? All right. So hopefully this gave you some insight into red light. Like I said, in the show notes, I'm going to include 2 links. One, a link to register for my upcoming red light therapy class so that you can learn how to use your device for what you need to use your device for. And number 2, I'm going to link my favorite affordable red light tool for horse owners. All right. See you next time. Thanks for listening.
Thanks for listening to the Equine Energy Medicine Podcast. Ratings and reviews are always appreciated. We'll catch you in the next episode.